sort of top-ranked question from Dr. Mark Miller is, could you comment on relative toxicity of wildfire PM compared to other sources of PM, such as urban or traffic? And so, Louisa, you had that slide where you compared emissions.
Yeah, and my understanding of these data is it was in vitro data or animal data. And what they did is I believe, if I'm not mixing up the studies, they measured toxicity in lung cells by looking at number of neutrophils, by edema in the lung, a couple of other things that I can't remember off the top of my head without looking at my lung, and without looking at my notes, and they looked at basically the response with exposure to wildfire smoke, wildfire PM 2.5 compared to other ambient sources, and their estimation was that it was 2 to 4 times more toxic.
Can I follow up on just the
Certainly.
Yeah.
I mean, certainly there's a large literature looking at wood smoke.
Yeah.
It is.
Yeah.
Sorry, thank you. Wood smoke is not good by any means, but it's a lot less than something like diesel exhaust or urban PM. So is there something else going on here? Is this, when we have wildfire smoke, is it plastics and other household things burning? Is it particular types of vegetation, or is it the heat interaction?
Yeah, I mean, it could be all of the above. I think it was that wasn't necessarily ambient burning, so it wouldn't necessarily be something like plastic, but of course in an ambient setting that would have a massive impact. And what I do want to stress here is when I was, those data I was focusing specific on, I guess less on wood smoke exposure alone, but a bit more on wildfire smoke, which I know they're kind of same but different. I guess I don't know. Long story short is I don't know, but there is indications that there is at least some increased toxicity in some of those in vitro studies and some of the animal studies.
Also, we do quite a lot of work in this combustion chamber we have, and also in the field where we collect samples and measure different species coming from fires, and not all fires are the same. So you get a huge amount of variation in combustion from flaming to smouldering, and if the activity involves a lot of smouldering consumption of fuel, you get hugely more damaging emissions per unit of mass burned, basically. So if it's a very clean fire, essentially most of the emissions are put into CO2, and CO2 in smouldering is still the highest amount, but the amount of particulates and other air pollutants can be 10 times higher in smouldering per unit mass burned compared to flaming fires. So it does depend on how the material is actually burned.
Yeah, and there is one. I remember one study that looked at some of the comparisons between flaming and smouldering on some of the impacts, and I don't remember the outcomes of the data, but there were definitely differences there, for sure. And then I do recall as well, one of the papers cited the sort of, I guess, higher carbon content in what was burned as potentially having implications on the oxidative stress and inflammatory pathway more, but I'm not an engineer, so. Sorry.
Rachel Huxley, Wellcome Trust. Thank you so much for those incredibly informative talks. I wanted to ask sort of one quick follow-up to this conversation, which is, have you looked beyond PM 2.5 at what the pollutant mix is? So particularly interested in like black carbon, for example, but other aspects of wildfire smoke to perhaps continue that conversation. And I suppose a second question, if I may, is it was really interesting to see some of the discussions around the kind of climate and health, both in terms of the causes, but in terms of the solutions. And I just think it's really important to keep those kind of two linked. And some of the solutions that were given would be really good for health, but not necessarily from a climate perspective. And that's not a reason not to do them, but just to think about it in the round. I hope that made sense.
Yes. In terms of different species, there are lots of, increasingly more species are being investigated. It's hard, they're generally in low concentrations. So PM is in high amounts in smoke. carbon monoxide, carbon dioxide, methane, these kind of things. And then you get all these volatile organic compounds, which I think are, some of them are carcinogens and things. They're in low amounts. They're quite difficult to measure in the field without very sophisticated equipment, which thing is, these are unpredictable events, so it's quite difficult often to take all this equipment to them. We have an aircraft from British Antarctic Survey that actually is based in Canada that we do that kind of work from. We fly through smoke plumes, essentially, and also in labs we can kind of try and recreate different burning conditions. So VOCs are investigated, yeah. Black carbon, that is mainly a product of flaming combustion. So in something like the peatland fires in Indonesia, there's actually very little of that. But in these big, intense wildfires in Canada, plenty of it. And we heard, it can be deposited on snow and ice and things like this, and essentially make them less reflective, and that contributes to, increasing local warming, at least temporarily. What was the other question, sorry?
Oh, the other question was keeping climate and health in mind in terms of both the sort of causes, but importantly in terms of the solutions.
Sorry, can you just reframe that question again? Because I know there was some more preamble at the beginning of it.
So just thinking about how we keep both climate and health outcomes in mind, both when we're thinking about the cause of the issues that we've been talking about, but really importantly, the solutions. So some solutions will be good for health, but sort of somewhat negative for climate. And I'm not suggesting we shouldn't do those, but how do we kind of address both the climate and health kind of causes and
for example, would that be something like cooling centers? Is that?
Yeah, and air
you're thinking
filtration, for example. So how do we think about what kind of solutions are going to tackle, but are going to help address both the climate impacts and the health impacts? And again, I can't emphasize enough, I'm not suggesting we don't do cooling centers and we don't provide air quality filters, but how do we get to like the sort of root cause so that and your point you so eloquently made in your presentation is that these aren't all accidental. There's quite a lot we can do to reduce the amount of fires. And I think Zorana spoke really nicely about emphasizing both the climate and health outcomes. So I don't know if she wanted to come in on that point maybe.
Go ahead, Zorana.
Yes, thank you. You can hear me. Thanks, Rachel, for bringing a very important point. I think the best way to use it, at least in my talks, is that we still can focus on mitigation. I mean, if we talk about air pollution filtration as a solution, of course, there's a strong social inequality aspect, and who can afford these? Of course, they can be very right for very severe chronic patients, and they should have them lung patients, for example. Same when we talk about heat impacts and air conditioning, which exacerbate the effect of climate change because we use energy much in the summers, but they're the only way out of the heat wave. I was just part of big one down here south where I am. So I think we use them just to stress message how important it is still to reduce major sources of greenhouse emissions and air pollution, because we can still mitigate somewhat and not to end at the worst case scenario with heating and air pollution, and to try to reduce or end up at the best possible scenarios with respect to increase in heat and air pollution, and mitigate wildfires by simply reducing the main sources. That we all come back to that, right? I think adaptation agenda may try to distract a little bit from that, and then we talk more about cooling and air filtration, but we just have to insist back that we still can end at a better scenarios if we insist in urgent reductions of main sources of air pollution and climate change. I hope that answer some of what you wanted, Rachel.
I could say something about, we had an interesting and unsettling experience in Indonesia. We were asked by UNICEF to go and check some schools during this terrible El Nino-driven or exacerbated fire event. And they had some technology in these schools, low-cost technology that was supposedly filtering the air in the school. So it was haze-free classroom, I think it was termed. So they would basically bring the children in and open the windows and doors and everything extremely minimally, and the air inside was being filtered, apparently. what we actually found was the air pollution in the side was worse than outside, because essentially the boundary layer kind of collapses at night and traps all this smoke that the fires are much more prevalent in the day than at night. Most places in the world, maybe not so much these peat fires, but even they are as well. But most places in the world, there's very few fires going on at night compared to the day. And the smoke is, being distributed in the atmosphere and rising through the atmosphere. But at night, the boundary layer collapses and brings it all back down to close to the surface. And basically, it was all infiltrating these schools at night. And so if you trapped, you essentially trapped it in there in the morning. So it's actually bad news in that case, to seal up all the doors and windows, because you were trapping polluted air inside from overnight, and when the sun comes up and everything starts heating up and the boundary layer starts rising again and all the smoke starts at least somewhat dispersing, it wasn't dispersing out of these buildings. So you have to be aware as well what's happening. They were actually doing the opposite to what would have been good for the children.
Yeah, go.
Just one for Louisa. You mentioned air quality warnings, and you said that you've seen some success. All the research I've seen in the UK is you ask someone about air quality, they go, "Oh, it's terrible. I have to adjust the way I live because of poor air quality." "Oh, do you look at air quality warnings?" "Yes, I do." "What do you do when you see it's high poor air quality?" "Oh, I don't do anything. I just carry on with my day." To the extent that the UK government Committee for Medical Effects of Air Pollution is advising that we go to a symptoms-led approach and moving away from air quality warnings, because it's had no real effect at a public health level. What's Canada doing so well that we're not, to actually activate, to get behaviour change, and we're not managing it?
Yeah, I mean, I guess I would say that was a narrow study, right? So, we're not the be all and end all over here. So just bear that in mind. And we do have the Air Quality Health Index in Canada, which is very similar to what you have in the UK. I was even looking at the UK messaging the other day, and it's almost identical in that, yours is called an air quality index, but ours is called an air quality health index, where we focus on the collective impacts of the pollutants on health outcomes. So I don't know what we're doing differently. I don't know, possibly in some of our messaging, we just maybe, instead of solely emphasizing the number, we're really emphasizing the recommendations on those with pre-existing conditions compared to not. It could have just been the demographic of the people in the study who are motivated for health. It's probably a pretty homogenous group that are the findings applicable widely. I mean, we can't say for sure, but certainly in this demographic of people, the tools were used and they were useful to shift behavior change. But yeah, I think what people can grasp onto is how a symptom feels. Am I coughing? Am I wheezing? Are my eyes watering? So a symptom-based approach or a health-based approach could be the way to go.
Yeah, the challenge to that is it then pushes the problem to primary care, and in this country, our primary care is already very stressed.
Yeah, we're not doing so well in Canada either.
I'll take the next question from the chat, and this is a bit of a mix of Earth observation science and health. We heard from Zorana's talk that air pollution and heat at the same time, they have synergistic health effects. But the question was in relation to an article in The Economist that showed that sort of sustained levels of air pollution over the Indian subcontinent have led to less of a temperature increase over South Asia. And the question was really, I guess, I don't know, this is a bit for you, Douglas. How would you, it's kind of a regional versus a global phenomenon. And I guess the question was, how do we prioritize or convince people when it comes to policy solution or to buy in?
So you're saying that the smoke is cooling the local.
Just in the Indian
Yeah,
subcontinent
that can
only.
happen. I mean, we've been at big wildfires in Canada, or actually prescribed burns, and after you've lit this thing, a few hours later, it's way cooler because you've got a massive amount of smoke shielding the earth from the sun to some extent. There's more complicated things. You can get cloud condensation. The particles act as cloud condensation nuclei. You may get more or less clouds depending on various issues. So I think actually the impact of biomass burning on radiative forcing is variable. There are some bits that can increase it and some bits that can reduce it. But typically, something like 15% or so of the greenhouse gas increase in the atmosphere that we see, which is the net root cause of climate change, is down to land cover change, basically cutting down forests and replacing them with stuff that stores less carbon. So now this carbon is in the atmosphere in the form of CO2, or burning of peatlands that we saw as well. Because the other kind of types of biomass burning, burning in Canada's forests need fire, right? They've evolved to have fire within them. It would be a bit of a disaster if fire was removed from Canada's forests for the ecology. So there may be too much of it, but it is not that you want to get rid of it. And the savannas of Africa are the same. And those places, the forest and the grasslands, the savanna vegetation regrows. So they're not a net source of CO2 to the atmosphere, but deforestation, fires typically in the tropics, and peatlands are responsible for whatever 15% or so of net CO2 emissions to the atmosphere. So that's on top of obviously the main dominant source is fossil fuels. I'm not sure if that totally answers that question, but it's related at least.
Yeah, and definitely that air pollution over South Asia has very significant health effects at the time. So there may be a temporary regional smaller increase in heat, but the health consequences are still worse.
Thank you very much. My name is Irenaeus Soiri. I'm an epidemiologist, and I do have interest in global health and air pollution. One of the things that is quite burning for me, which we haven't discussed, is the issue of metrics, particularly in the global south, and also advocacy. Metrics because we do have WHO guidelines, which we have been introduced to, and these guidelines are not easy to convince policymakers to implement because they don't see how they were created. And in the global south, we don't have the measuring capacity that we are seeing in the Western countries. So I would be glad if we could spend some time to comment on how we can improve the metrics of air pollution in the global south. And that will maybe give us an opportunity to help with the advocacy, because when you go to talk about the effects or impacts of air pollution on population health, the policymaker wants to see where the data is coming from. And if the data is largely generated elsewhere, it is hard to convince them to implement the guidelines that we are proposing here. Thank you.
Yeah, so I wonder if that's a bit of a contrast between sort of fixed site sensors and local sensors versus satellite data, that's one of the big advantages of the satellite data is that it is global, whereas if you have a situation where you don't have a good network of fixed sites, you have to rely on the satellites, but then there's limitations and advantages to both. I see you're unmuted, Dr. Anderson. Did you want to mention something?
I appreciate your question very much. I think one of the big barriers that not more is done in global south is, especially as you name it, lack of measurements, lack of data, lack of local health studies, and you can easily raise doubt on how important is Danish study on asthma in children in African country that has quite different sources and population demographics and so on. So I think it's extremely important to besides satellite data, which bring us enormous opportunity to map air pollution globally and provide some local data where there's none, to also invest in local measurement campaigns, small projects, small health projects, that anything you can start from to provide some of those local evidence that speaks to local politicians, but also local NGOs to engage citizens, and from small citizen studies to health studies from wherever you can. So although we have enough global evidence to generate action everywhere, I know there's a lot of doubts locally when you lack data. So I think this is extremely important issues, and we need more awareness, more funding, more support to places where we lack any data, because they will matter and bring more policy around. So thanks for raising that important question.
Martin?
Yeah, just to say it is very important that satellites are great, modeling is great, but it is important to evaluate the correctness of these data, because often they're big grid cells and things like that. They might not necessarily represent, exposure of an individual. One of the things we found in Laos, unlike Indonesia, where the model and the data agreed very well, the data from the in situ sensors, in Laos, it's not agreeing so well at the moment. Why? Maybe we're working it out, but it might be because it's a very topographic country. The villages where we've installed these sensors are at the bottom of valleys, but the grid cells of the model cover mountain tops as well as valleys in one grid cell. So the smoke generally, accumulates in the valleys. I would say that those small sensors that we've used, these things called purple airs, when you buy one, you're able to essentially, if you can hook it up to the internet, so it's just on a wireless, it's connected to the manufacturer's website, who basically run a global network. There are thousands of them, thousands and thousands and thousands all over the world. There are many in the global south. We've installed some in DRC actually recently. And so, I think increasingly it is possible to get data. You do have to be a little bit careful about the calibration that I was mentioning. They're kind of generic sensors, and so if you're in an area where it's a kind of single source, biomass burning is dominant over other things, then you might need these calibration factors. But you have to do that once, and they are available increasingly in the literature.
Great. So I think we're out of time for this session. Okay, really fast.
So patient. I have a lot to say, but I'm going to limit it to 2 comments, actually.
Okay.
And as somebody who lives in India, thankfully not in New Delhi, there are 2 things. On the point of data, I think it's important to also remember that while we're looking at technical inputs, and data is important, data without a plan for action is useless. And that's been my experience as working for the last 2 decades on air quality and looking at Minivol, looking at PM2.5 low-cost sensors, mapping heavy metals that attach themselves to particulate matter and looking at health impacts. We have seen the best place where even if there is limited data has really shown change is when community has participated and had a plan for action on how to act on that data. So that's my word of caution. And my second comment, especially on the Economist question, the Economist article question about heat versus, I find that kind of narrative extremely distracting and misleading. Because if the heat will not kill you, asthma will. In both cases, it's not an optimistic future. And I think pitching one climate crisis or one extreme weather event to another is just a very mischievous way of taking the attention from looking at systemic issues and addressing the root causes. And I mean, I'm glad that question came up, but I also want us to be aware that these kind of distractive methods are used to shift our focus away from acting on keeping the fossil fuels in the ground. So that's it. Thank you.
Thank you very much. That's a perfect way to end the session. So thank you. So we'll have the 2 more sessions today. And there's plenty of time during the refreshment to approach the speakers and follow up with your questions. And I'd like to thank the speakers for their time today, and the organizers and the Physiological Society and the Wellcome Trust. Thank you, everyone.